Hello, I'm Peter Howarth. I'm Global Clinical Scientific Lead at GSK and also associated with Sharp. And I'm delighted today to have with me Randall Brown, who is Global Lead in Respiratory Medicine and Immunology at Teva Pharmaceuticals and has a long history of patient management as being a pulmonologist for 30 years before moving into industry. So he can see things both from the patient perspective and from the industry perspective. So Randall, perhaps you could give me your perspective of why you think it's important for us to evaluate real-world outcome data as opposed to perhaps randomized controlled trials, which have been considered the gold standard.
Well, thank you, Professor Howarth. It's a delight to join you. This is important. Professor Hilary Pinnock, I think, puts it best. There are some 525,600 hours in every single year. And yes, clinical visits are important, but the vast majority of the time that is spent in real life. On average, some 90% plus of patients are engaging with their doctors no more than 100 minutes out of the year. And so that leaves 99.99% of the rest of the year in that real world, real life space. And so having understanding at the patient level, it's really information that the patient and the family understands about what's happening with their own bodies that's so important. And then perhaps having that shared with their clinician creates a much more rich dialogue as to what's happening on a day-to-day basis. And those are the keys to overcoming the challenges of managing chronic respiratory illness, in my mind.
I think you highlighted an important point that's often overlooked there. You mentioned the families, and we focus a lot on patients and the impact on them, but families are a unit, and patients' illness impacts on families as well.
Very much so. And I think that the more that we can, as those who are outside of that immediate patient-family dynamic, the more that clinicians, the more that pharma, the more that health educators engage not only in the patient, but in the family understandings by asking not only about the disease, but asking open-ended questions as to how that disease might impact both patient and family, the better off we'll be.
So with your sort of industry hat on, why does pharma need collaborations with groupings such as Sharp?
Well, it's incredibly important. Sharp brings, over my 30 years, the best of all organization, professional society representation, brings all stakeholders to the table. And there needs to be this exchange. I recently had an airline flight, and I was thinking about how I want my pilot to know about all aspects of that plane. I want them to know, yes, about who's in the cabin, including myself, but I want them to have an understanding of who the makers of the fuel are, of the engine, of the wing. And it makes me more comfortable having that pilot, having she or he understand all of those elements of care, bringing all of those stakeholders to the table, and then coming up with the best solutions. But I'll say, the best solutions always and foremost, exactly as Sharp does, with the patient at the center.
Obviously the focus for Sharp is the patient, and as you highlight it, it's tried to engage a range of stakeholders to get different perspectives and look to see how one can move forward to improve outcomes for patients. So how easy has it been for industry to engage with Sharp?
I think it's been phenomenal. I think Sharp recognizes the importance of this dynamic, and because of its patient centricity, it is a trusted arbiter of this information. Trust is key here. And that's why when we talk about patient and family, we're talking about areas where if you can gain and deservedly gain trust, then you can make key steps forward in terms of managing patients in some very complex illness. And what Sharp has done is reached out and they've said, hey, we need you at the table, not to run the show, but to be a fair and balanced voice in this conversation. Because what you do and the decisions you make, we want to make sure you're having the patient and their families at the center of the decisions that are made. So, yes, it has been very easy and it has been right-minded, in my opinion. Sharp is nothing short of outstanding.
You highlight how this is a partnership between all the different stakeholders. And I suppose, one of the things that comes to mind is do you think all the stakeholders have equal standing? Has pharma the same standing as other stakeholders?
I think that they have standing. I think that they have inclusion, but I don't think, nor do I think they should have equal standing. I think the standing is just the right amount, as we've discussed. And as I've heard you say many times before, it's the patient, the patient, the patient. And so we are there to support the Sharp efforts in understanding how severe asthma works. We are there to understand and provide solutions, but it is the patient advocacy, the patient groups that have the most focus and the most standing, with pharma having the right amount of standing. And it is a voice that is heard, it's a voice that is listened to, but it is not a voice that dominates. And I think that's quite appropriate.
And do you think that it's been a relevant experience as far as your involvement is concerned? And how do you think that pharma can help improve outcomes for patients through Sharp collaboration?
Well, I think that what we've done in medicine, it's been quite the journey. Many of these illnesses, as I've said many times before, are just as much illnesses of information and of communication as much as they are of inflammation or bronchoconstriction. And so in this age where Sharp has access and allows for not just one patient or 10 patient examples, but thousands upon thousands of patients, and understanding the information that they are essentially telling us through this data to come to fore, it definitely provides direction for ways in which pharma in their research, pharma in their development can provide the answers. So if we're not listening to what Sharp has to say, then we shouldn't be in this industry at all. It's that important.
Thank you. Yes, obviously, any initiatives have to be addressing the unmet needs as far as patients are concerned. So, Randall, thank you very much. I've been talking today to Randall Brown, who is Global Lead for Respiratory Medicine and Immunology at Teva Pharmaceuticals and an integral partner in Sharp. Randall, thank you.
Thank you.
If you'd like to hear more podcasts about the work being done by Sharp from the perspectives of different stakeholders, then visit the Sharp website at europeanlung.org/Sharp. You can also find additional information about Sharp project and research programs, as well as how to join the Sharp CRC by visiting the website.